In the first part, we have talked about the health and the diseases. In the second part, we have talked about the orientation, immunity oriented. Now we are going to talk about some severe diseases like AIDS. Full form is acquired immunodeficiency syndrome. It is the deficiency of immune system. Syndrome means a group of symptoms. It is caused by the human immunodeficiency virus. HIV, basically a retrovirus with a RNA genome. Now you can ask that what is retrovirus? It is a group of virus that when enter into the host body, they basically enter their DNA into the host DNA and replicate it. For as a result, the host DNA sequence become mutated. So it create some genetic diseases. Now, if we are going to talk about the AIDS, AIDS itself not created any symptom. The main motive of AIDS is to destroy the immune system so that simple common cold can become the pneumonia. So as a result, it become fatal to many diseases. So AIDS was first reported in America 1981. In last 25 years, it killed over 25 million persons. Now, what are the way of transmission? The first thing is sexual contact with infected person, transfusion of contaminated blood and blood products, sharing of infected needles from infected mother to her child through placenta. Now, high risk people of getting HIV. See, if individual with multiple sexual partner, it can cause individuals who require repeated blood transfusion like thalassemia, hemophilia. These people needs blood transfusion alternate months. So if it is not properly checked the blood, it can be transfused. Drug addicts, after taking the drug, they are out of control. So they may be use the same syringe. As a result, it can be caused. Children born to an HIV infected mother. HIV does not spread by mere touch or physical contact. It spreads only through the body fluids, nothing else. There is a time lag from a few months to 5 to 10 years between the infection and when they are going to show the appearance of the symptoms. So, when they are not showing, but infection has already entered into the body, that is the time lag period is known as incubation period. Now, how the retrovirus, I told you how the retrovirus replicate. First of all, retrovirus have a RNA. So you can see in the picture the purple color viral protein coat and deep purple color RNA is there. Now RNA will enter into the cell. Then viral DNA from RNA By the reverse transcriptase, RNA will produce viral DNA. Then viral DNA will enter into the host genome. You can see. As a result, new viral and host combined RNA will produce. As a result, many other viruses will produce. So now new viruses can infect other cells. In this way, retrovirus basically work. So now you can see HIV first enters the body. They go to the macrophages, act as a HIV factory. Then RNA replicates in the presence of reverse transcriptase and create the DNA. Now viral DNA incorporate into the host DNA. Now infected cell produce viral particles. Then HIV virus enter into the helper T cell, replicate and produce progeny viruses. Many viruses will create, attack other Th cell. As a result, T cell become decrease, immunity become weakened. Now effect during this period, the person suffer from fever, diarrhea and weight loss. Due to deficiency of Th cell, he may be infected with mycobacterium, viruses, fungi, parasite like toxoplasma. We can diagnose this disease by ELISA test. The full form is enzyme linked immunosorbent assay. The treatment antiviral drugs are partially effective. They can only prolong the life of the patient, not cure it. Now, how we can prevent the AIDS? Controlling drug abuse, educate people about its use of disposable needles and syringes, free distribution of condoms, making blood bank safe from HIV, regular checkup for HIV, advocating safe sex. All these things, if we can do, we can somehow prevent the AIDS. Now, the cancer. Cancer is an abnormal and uncontrolled multiplication of cell. As a result, it creates an unlimited growth of cell which like a mass of cell and create a tumor. Normal cell show a contact inhibition. That means contact with the other cell inhibit their uncontrolled growth. But cancer cells do not have this property. So basically when the tumor is formed, they are basically two type, benign and malignant. Now if we are going to talk about the benign, confined to the place of its origin where it will be produced, it will be placed in that region only. They do not spread to other parts, cause little damage. If you talk about the malignant tumor, mass of proliferating cells, neoplastic or tumor cell that grow rapidly, invade and damage the surrounding normal tissue. Due to active division and growth, they starve normal cell by competing for nutrition. Those cells sloughed from tumors reach other sites via blood where they form a new tumor. So this movement create another part of tumor. This process is known as metastasis. So the thing is cancer detection and diagnosis, biopsy, imaging technique, use of antibodies, molecular biology technique. Biopsy means a thin piece of suspected tissue is stained and examined under microscope, which is known as histopathological studies. In case of leukemia, biopsy and histopathological studies, blood and bone marrow test for increased cell count. Now, imaging technique, radiography, use of X ray, CT, computerized tomography, scan, use X ray to generate a 3D image of the internal of an object, MRI, magnetic resonance imaging, uses magnetic field and non ionizing radiation to detect pathological and physiological changes in the living tissue. Treatment of cancer, radiotherapy, tumor cells are eradicated lethally without damaging surrounding the normal tissue. Chemotherapy, use of chemotherapeutic drugs. Many drugs have side effects like hair loss, anemia, etc. Immunotherapy, the patients are given biological response modifier. Example alpha interferon, which activates their immune system and helps in destroying the tumor. Surgery. Most cancers are treated by combination of surgery, radiotherapy and chemotherapy. Now we are going to talk about the drugs, smoking and alcohol use abuse. So drugs are commonly abused drugs, opioids, cannabinoids, coca alkaloids. Opioids, they bind to specific opioid receptor in CNS and gastrointestinal tract. Example morphine, heroin, brown sugar. Morphine is extracted from the latex of the poppy plant, Papaver somniferum. It is a sedative and painkiller and useful for surgery. Then heroin, smack or diacetyl morphine. It is a white odorless bitter crystalline compound. It is obtained by acetylation of morphine. It is taken by snorting and injection. It is depressant and slows down body function. Cannabinoids, they interact with cannabinoid receptor in the brain, generally taken by inhalation and oral ingestion. Natural cannabinoids are obtained from the inflorescence of the plant Cannabis sativa, that is hemp plant. Its flower top, leaves, and resins are used to produce marijuana, hashish, charas, and ganja. Natural cannabinoids are obtained from the inflorescence of the plant Cannabis sativa. Its flower tops they and resin are used to marijuana, hashish, charas, and ganja. They affect the cardiovascular system. Cannabinoids are abused by some sports person. Now the third kind of is coca alkaloid or cocaine. It is obtained from coca plant, Erythroxylum coca. It interferes with transport of neurotransmitter dopamine. Cocaine is usually snorted. It stimulates CNS producing euphoria and increased energy. Excessive doses of cocaine causes hallucination. Atropa belladonna and datura are also hallucinating a plants. Drugs like barbiturates, amphetamines, benzodiazepines, etc., are used as medicine to treat mental illness like depression and insomnia. But they are abused, resulting in impairment of physical, physiological, or psychological function. Now we are going to talk about the smoking. Tobacco has been used by human beings for over 400 years. It is smoked, chewed, or used as a snuff. It contains many chemical substances like nicotine, which is an alkaloid, which stimulates adrenal gland to release adrenaline and noradrenaline, causing high blood pressure and heart rate. Smoking causes cancer of lung, urinary bladder, and throat, emphysema, bronchitis, coronary heart disease, gastric ulcer, etc. Tobacco chewing causes oral cancer. Smoking increases CO content in blood and reduces oxyhemoglobin. As a result, oxygen deficiency in the body. Now, why the adolescents are linked with the drug or alcohol abuse? Adolescence is a kind of period, or you can say it is a process during which a child becomes mature in terms of his or her attitude and their belief for effective participation in society. So it is a bridge linking childhood and adulthood, period of 12 to 18 years of age. It is very vulnerable phase of mental and psychological development. Now, causes of drug or alcohol use in adolescence: curiosity and experimentation, need for adventure and excitement to escape facing problems, stress from pressure to excel in academics or examination, television, movies, news, papers, internet, etc. Unstable or unsupportive family structure and peer pressure. Now, addiction and dependence, psychological attachment, euphoria, and temporary feeling of well being to drugs and alcohol. With the repeated use of drug, the tolerance level of receptor increases. Thus, the receptor respond only to a higher doses, leading to greater intake and addition. Now, dependence, the tendency of the body to manifest a characteristic and unpleasant withdrawal syndrome if regular dose of drugs or alcohol is abruptly discontinued. This result in anxiety, shakiness, nausea, and sweating. Dependence leads to social adjustment problem. What are the effects of this? Reckless behavior, vandalism and violence, coma and death due to respiratory failure, heart failure, or cerebral hemorrhage. Drugs mixed with alcohol may cause death, damage of nervous system and liver cirrhosis, mental and social distress to family and friends, social problems like stealing and spreads of infectious disease, example AIDS and hepatitis B. Use of drugs and alcohol by pregnant women affect the fetus, called fetal alcohol syndrome, loss of sexual drive, and necrospermia. Misuse of drugs by athletes, example narcotic, analgesics, anabolic steroid, diuretics, and certain hormones to increase muscle strength and bulk and to promote aggressiveness. So, what are the warning signs of drug or alcohol abuse in the adolescence period? Drop in academic performance and absence from school, lack of interest in personal hygiene, withdrawal and isolation, depression, fatigue, aggressive and rebellious behavior, change in sleeping and eating habits, fluctuation in weight, appetite, etc., loss of interest in hobbies, deteriorating relationship between family and friends. So, what are the side effects of anabolic steroid abuse in male? Acne, increased aggressiveness, mood swing and depression, reduced testicle, decreased sperm production, kidney and liver dysfunction, breast enlargement, premature baldness, enlargement of prostate gland. If we see in the female, masculinization, increased aggressiveness, mood swing and depression, excessive hair on face and body, abnormal menstrual cycle, dip, deepening of voice, enlargement of clitoris. Now, in adolescence, male and female, severe facial and body acne, premature closure of the growth center of the long bones, resulting in stunted growth. Prevention and control, avoid under peer pressure, education and counseling, help from parents and peers, looking for danger signs, seeing professional and medical help such as psychologist and psychiatrist, de-addiction and rehabilitation program. So this is the chapter of health and disease. Yes, I have make a video on the PowerPoint slides, but if you see the NCRT, you can link it because the topics are the same. So I think you can understood the chapter in this way. Now you just read the chapter in from NCRT. If you feel any doubt, ask me anytime. Thank you, students.